For 34 years, Steve Hicks handled radioactive materials. He worked at the Y-12 National Security Complex. It's the site that helped construct the atomic bomb that was dropped by the U.S. on Hiroshima in 1945. And it's still a key part of the country's nuclear weapons complex.
I would carry enriched uranium against my chest and go and load it on the machine. Yeah, I was handling hazardous materials for years, and I knew it was possible health effect, but I thought I was going to be the one that got out safe, but I wasn't.
Hicks, who is 70 years old, now spends his retirement managing the 30 daily medications to treat the effects of diseases linked to decades of radiation exposure.
I developed neuropathy, kidney cancer, skin cancer, and diabetes from all the steroid shots I got.
He's also petitioning the U.S. Department of Health and Human Services to pay the medical bills of thousands of fellow Y-12 employees battling job-related cancers. 80 years after the U.S. dropped atomic bombs on Hiroshima and Nagasaki, healthcare for thousands of former atomic energy workers in the U.S. is in limbo.
What are you doing, Mom?
That's because in late January, HHS suspended the Advisory Board on Radiation and Workers' Health indefinitely. 18 former workers, board members, and administration officials told Reuters. The board reviews compensation claims made under the Energy Employees Occupational Illness Compensation Program Act of 2000. Without that review, petitions can't advance and workers are left on hold.
1980, I'd say, don't work there, Steve. That's what I'd tell myself. I made a good living there, but I'm not too happy that I'm this sick. And there's other people sicker than me.
The Centers for Disease Control and Prevention, an agency of HHS, says the suspension was because of outstanding administrative requirements which the program is working on. The White House declined to comment on the status of the board, and the Energy Department said in a statement that it is learning from past mistakes as it focuses on modernizing the nuclear arsenal.
You got any feed in there?
Over 700,000 people have been employed in the U.S. nuclear weapons complex since World War II. The work includes mining, moving, and processing radioactive materials for military and civilian nuclear programs at 380 American sites. Denise DeGarmo witnessed her father's painful death from an aggressive radiological cancer. It spurred her to get compensation for nuclear workers and their survivors.
My father worked for General Electric. He worked as a design engineer for the Intercontinental Ballistic Missile System and the Nike Missile System. And in 2000, he came down with a very weird, kind of unusual form of bone cancer that was directly related to radiation exposure. So in the last 6 weeks of his life, we couldn't even touch him. His bones would shatter.
DeGarmo's home office is filled with Cold War-era atomic memorabilia and thousands of documents she has dug up to support her petitions. She has 3 stalled in the queue, which she says represents as many as 2,000 workers and their descendants. She was planning to submit 2 more this year.
And we can't even guarantee they're even going to be evaluated at this point. We know that they've been submitted, but we're at full stop. And these folks, these workers, these unsung heroes, have waited years to have their day, and now there is no guarantee they're going to have their day at all.
The Compensation Program Act provides a $150,000 lump sum payment and medical insurance to eligible workers from the U.S. nuclear sites. It's available to those diagnosed with cancers linked to high radiation exposure, or who can prove such exposure during their employment. As of last year, the U.S. had given out over $25 billion in compensation and medical benefits to 141,000 atomic weapons workers, according to the DOE. The advisory board was reviewing 8 petitions when its activities were paused, part of President Donald Trump's efforts to streamline the federal government.
And what does it say? Trump won, save America. Well, I'd hope if he got the message that he would reinstate it and know how important it is to the sick workers. I think it boils down to the money. They're saving money even though they got the program, but they're saving money by not giving us the benefits we deserve.
3 of the board's 10 members told Reuters they haven't met since December and have had no information about reconvening. Worker advocates told Reuters they had been planning to file 3 more petitions this year, including the one put together by Hicks. Each of them represents claims from thousands of former nuclear workers. Hicks received medical coverage earlier for kidney cancer. He is now seeking assistance for treating skin cancer. He said he has sent dozens of letters to Tennessee's senators and lawmakers in other states with major weapons facilities. Some of his petitioners don't have time to wait.
I contact politicians in the White House, and I hadn't heard anything back from them. I would like for Trump to see this and understand how important the SEC board is to the workers, the sick workers.
Hicks's father worked as a machinist at Y-12 until he retired in 1994. A year later, he was diagnosed with myeloid leukemia. His doctor says it was because of his exposure to enriched uranium.
You know, it's sad to see him go. And then I think back, when I first worked there, I know it was dangerous, but I didn't know it was as bad as it was. Maybe this will wake somebody up and they'll see the problem with this.
Feeling that you gave your life for the American way and America has abandoned you. There is not enough money in the world for anybody to go through those kind of conditions.